Hello friends, welcome to my YouTube channel Health Tips with Dr. Deeptimala. In our continuation of the handbook for pregnant women, we have come to the last chapter, Knowing Your Baby. Now, what are the positions for breastfeed? Sit erect with back support, pillows under the knees. Do not bend your waist and do not let your weight fall on. The tummy of your baby should face and touch your tummy. The head of the baby should be higher than the rest of the body. Lower arm should be released. The entire areola will be covered with baby's mouth and nipple would move back and forth. If baby's cheeks cave in, it means baby is not properly latched. Never feed the baby when he or she is in bad mood. What is rooting reflex? If you touch the baby's cheek with your nipple or finger, he will turn towards the breast and try to latch on. This is instinctive and can be further encouraged if you express colostrum onto the baby's lip. This is the rooting reflex. Now, what is latching on? When the whole of the nipple area is inside the baby's mouth with his tongue underneath the nipple, the baby is properly latched on. Breaking the suction. At the end of the feeding, do not pull your breast away from the baby. This will make your nipple sore. Instead, insert your finger into the corner of the baby's mouth and gently ease him off the breast. When you feed for the first time, make sure you are relaxed, take few deep breaths, make sure people are not around. It has to be only you and your baby in isolation. Feeding can be started or attempted within 2 hours of normal delivery. Mother's milk is a rich source of fluids, calcium, protein in the morning, and the quality reduces as the day passes by. Physiological variation in the content of the milk. Avoid chilies and spices in your diet as it alters the taste of milk and may cause skin problems in baby. Now, useful tips for you as a mother for breastfeeding. The initial 6 to 10 days. Breastfeed every 2 hours. It hurts like pin and needles when milk is produced in the breast. Clean your nipples with water before and after each feed. Put the baby to your each breast for 10 minutes alternately so that there is no soreness and stimuli is sent to brain from both the breasts. While changing the breasts and getting the nipple released from the mouth of baby, put your smallest finger inside the mouth and change over quickly. Stop feeding only when the baby ends. Feed only on demand and as long as the baby wants. Put to only one breast during one feed because initially milk contains carbohydrates and later fats. If while taking feed baby falls asleep, wake her up by taking back of ear or feet. Keep your breasts clean with soap and water regularly. Keep nipples dry. Make breastfeeding session a relaxed occasion. Cuddle your baby close, sing, talk to him, make eye contact, but at the same time, please do not disturb your highness. If you feel the quantity of milk is not sufficient, do not try to build up supply by cutting out breastfeed and offering a bottle. Check if baby is latched properly and rather offer more breastfeeds so those breasts will produce more milk. Burping. Some babies swallow enough air during feeding to cause them discomfort. Hold your baby in an upright position and pat her back. If nothing happens and the baby is happy, there is no need to wait for a burp. Some babies spit up, others do not. The commonest cause is overfeeding. Keep your nipples dry, exposed to air, apply cream and avoid soap on the nipples. Breasts become swollen with milk and are painful to touch. To prevent this condition, it is important to position the baby correctly while feeding. Express some milk by hand to soften the breast before starting to feed. Apply hot water bottle to encourage the flow of milk. Continue to breastfeed. Use breast pump if required. With this, we come to the end of this video, and I will continue in the next video further.